Hi, my name is Dr. Emily Ward. This is my dog Oberon, and this is my lead technician Rachel Thomas. She's going to be helping me today as we perform an oral examination on Obi to evaluate his oral health. The first thing we do is we gently lift the lips of the pet. And what I'm looking at in these examinations is how much tartar and calculus buildup is on the tooth surface, so that brown stuff that you'll often see here. And the next thing I'm looking at is right here where the tooth goes into the soft tissues, the gingival margin. That's the gum tissue. And I'm looking to see if there's any evidence of inflammation that could suggest periodontal disease. I continue my examination gently by looking at the back of the mouth, examining the molars and the premolars. Then I will turn to the front, gently lift the lips again, and examine the incisors. And then I'll finish my just brief overview of the mouth on the other side by looking at the teeth over here on his left. The next thing that I typically do is, now this is just one side of the tooth, right, which is a three-dimensional object. Now I'm going to open his mouth, if he will let me. Some pets are not as polite as this one. And I'm going to look at the palate, and I'm going to look at his tongue, and I'm going to look underneath his tongue, and at the back of the mouth to examine all of the tissue that's in here. For some pets, I'm able to open the mouth very well, and I can actually move the tongue forward and examine the larynx and the windpipe too, to see the tonsils and the other structures that are back at the back of the throat. So I typically look my patient straight in the face. I assess the symmetry between the two sides. The next thing that I do is I gently start to palpate along the top of the upper jaw, the maxilla, to feel along the sinuses. Just like when we go to the doctor and they palpate your sinuses to see if there's pain, it's basically the same thing. I move all the way along, feeling the teeth through the cheeks, come up underneath the bones of the eye. I'm going to feel the temporomandibular joint, which is the hinge of your jaw, to make sure that's got some pretty normal function there. You should come around the base of the ear too, just to be sure. And then I'm going to feel the bottom of his mandible. And the lower jaw has a nice space in here where I can get my fingers gently below his tongue, so I can actually feel the entirety of this bone right here through his skin. But you can feel the mandibular and the sublingual glands, which sit right here at the corner of the jaw. The lymph nodes are also in this location. And Obi has normal salivary glands and lymph nodes. The last thing I do is I assess the muscles of the face. All of the muscles on the face are responsible for mastication or chewing, and all of them close the mouth except for one. There's only one muscle that will open the mouth. Up here we have the temporalis muscles. The masseter muscles are here on the sides. And then there are various other muscles that are more difficult to feel because they're behind these muscles here. But there are certain diseases that can cause atrophy of these muscles, meaning that they shrink down, either due to disuse or a neurological problem or some other type of inflammation or disease that could be present there. After that, that's the end of the oral examination while he's in the room. If there are other issues within the mouth, say there's a tooth broken, I will use a special tool called an explorer to look and see if that fracture is open to other parts of the body, if the pulp is exposed, if the pulp is alive, is it painful for the patient. After this, I'm going to continue to physically examine the patient because every patient goes under anesthesia, and I want to make sure that they're in a good, healthy state in order to be able to do well under anesthesia with as little risk as possible. I will continue to feel the lymph nodes. I will feel his belly just to make sure. You were the goodest boy, Obi. And then I will listen to his heart. Now we'll have a discussion about what I've found inside of his mouth, and we'll work up a treatment plan for you about the recommendations to restore his mouth to good health. The majority of the dental examination occurs when we have the patient anesthetized. This is for your pet's safety, and this is for our safety as the operator as well. Because we are working in the mouth where pets can bite, and also the equipment that we use to take care of your pet's teeth is the same equipment that's used at your dentist as well. Same x-ray plates, same x-ray tubes. The first thing that we do is we take the full mouth radiographs. We're going to take an x-ray image of all of the teeth in the face so that we can assess what's going on below the gum line. So we will put the x-ray plate into the mouth, and I'm going to take an x-ray of Layla's molars and premolars in her maxilla. I use the probe to measure the depth of any periodontal pockets that might be present. What I'm looking for is any measurements on this instrument that are deeper than 3 millimeters. In dogs and in humans, anything over that is going to be a sign of advancing periodontal disease. I take this instrument, it's blunt on the end, and I gently insert it underneath the gum line in order to assess the depth of any possible pockets that might be there. Several places around the tooth, including on the palatal aspect of this, which is the inside portion of the tooth that's difficult to see on a conscious exam. After all the diagnostics are performed, the next step is to do the treatment. Based on our diagnostic findings, we know what we need to do, whether that's oral surgery or, in the case of Layla here, what she just needed some periodontal maintenance care. Essentially what that is scaling the tooth, especially below the gum line where it's the most important, and then we will finish with some polishing to make her teeth nice and shiny. Once her oral examination under anesthesia is completed and both sides of her mouth have been treated, then we will recover her from anesthesia. And once the breathing tube that's in her throat is removed, she will stay with us for about another 3 to 4 hours just to make sure she continues to recover okay and that her pain is well controlled. After that, she'll go home with you later in the evening.